This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Clara Saldran, sitting in for Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
If you think about it, lung cancer is easy to sidestep, primarily because we know what causes it.
For the most part, we hardly see Filipinos consulting very early in the disease. And that's very sad because the earlier you intervene, the better it is for patients because the earlier it will be for us to help them.
Today, lung cancer remains to be one of the top killers in the country. Even non-smokers are at risk. According to the World Health Organization, 50% of Filipino women and children are exposed to secondhand smoke because of their proximity to smokers.
Obviously, Filipinos have not learned, and it's not just here in the Philippines. No? It's actually something that's also observed in other countries, that despite very aggressive anti-smoking campaigns, there will still be that one person who will still smoke.
Most people often ignore the danger signs simply because symptoms usually do not appear until it is too late.
Patients will become breathless, they cough, they also spit out phlegm. Many of them will also start losing weight.
But while lung cancer is preventable, it is also one of the least curable of all types of cancer.
They can decrease the risk of themselves having cancer in the future by avoiding high-risk behavior like cigarette smoking, alcohol consumption, exposure to chemical irritants in the environment, eating a healthy diet. These are not curative measures, but they can prevent. If a patient is diligent enough, it can actually prevent cancer from occurring.
How is lung cancer detected and treated? How can smoking lead to lung cancer and other complications? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Winfield Tan. He's an active member of the Council on Lung Malignancy of the Philippine College of Chest Physicians and a fellow and diplomat of the Philippine College of Physicians and the Philippine College of Chest Physicians. And you may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Win. How are you tonight?
I'm fine. Good evening, Claire.
Good
Thank
evening.
you for inviting us here.
So tonight our discussion will be about lung cancer. And like what we heard earlier, that there is a high incidence of lung cancer in the Philippines. It's a deadly disease that people know about, and yet, it's still there. So what are or who are the people who are prone to getting lung cancer?
Well, number one, that are the smokers. Those that smoke more than a pack a day for more than 10 years or so, they are at the very greatest risk for the lung cancer disease. And those that are with family history of cancers are likewise at risk. And the other group of patients are actually non-smokers. We are maybe surprised to hear about that, but evidence had been shown that in some group of non-smokers, especially women, but they are been exposed to other people around them, are at greater risk.
Yes. You mentioned that it's also hereditary. So let's say you're not a smoker and you have some history in your family who's had it. What percentage or what are the chances that you might get lung cancer?
Well, overall, as hereditary plays a very important role in all diseases. And one of the important organ that is affected is the lungs, respiratory tract. We may have a smaller percentage if we are going to go through the statistics, but most of these patients are just detected when they have two or more, members of the family that are affected. But in the statistic-wise, it is less than 5% or even less than 3% of the general population.
Okay, and you also mentioned, of course, tobacco smoking.
Yes.
Can definitely lead to lung cancer, and I think a lot of people know that by now. But what exactly how does smoking lead to lung cancer?
Yes, smoking could lead to lung cancer by progressively irritates the airway because the smokes, passes the respiratory tract, and the components of smoke, as we know, there are 40 to 60 carcinogens in it. And to mention just a few, we have the para-amino hydroxy acid, the tar, and other chemicals, So they, when a person smokes and it touches the air, it turns into something else. And this is quite fatal when this reaches the nucleus of the respiratory cell. And this will cause slowly but surely a mutation within the cell. So although it takes years, but in some cases, it may take quite just a small period of time. It depends on the dose of the chemical or the like cigarette smoke, and the length of years. That was studied already in the past, and it was established already. So when the cells mutate, then it will grow, it will multiply and form a tumor. So that tumor will be asymptomatic in case of lung cancer, and at times it can be even the patient would not be aware of it until it become disseminated. That's why lung cancer could be one of the disease that is diagnosed late because of late manifestation of symptom. But for the last 5 years or so, our technology has improved a lot. We have the imaging procedures, and one of these is the CT scans procedures. Although it is costly in our setting, but it has been proven in 2011 by a study done in U.S., a national lung screening trial, which could detect, in high-risk population, those who smokes 30 pack years, or they smoke 1 pack a day for 30 years or so. So these are the high-risk individual, which has a really high tendency to develop lung cancer.
Right, right. Those are high risk.
Yes.
But what about those that, they smoke a few cigarette sticks a day, but maybe in a long extended period of time, since maybe they were younger?
Yes.
So are they also at risk to possibly get lung cancer?
They are potential group for at risk, although they could succumb into airway diseases first.
Okay.
So cigarette smoke really could be detrimental to the airways and to the lungs. So we could catch a patient with airway inflammation, airway diseases, COPD patients. And
you said COPD?
Yes, COPD stands for chronic obstructive pulmonary disease.
Okay.
That is also another disease entity that afflicts most of our population and globally.
Okay.
Yeah.
So these are diseases that can lead to lung cancer.
A COPD patient has high tendency also. Some of them, about 20% of them, has a very greater risk for lung cancer. But it doesn't mean if you have COPD, automatically you will get lung cancer.
Right.
Most of the lung cancer patients are smokers, actually, and about 5 out of 10 of them have an underlying airway disease.
Okay.
So as manifested by non-specific symptoms, again, it could be cough, chronic cough, recurrent cough, and there could be some shortness of breath. These are really non-specific, and most of the time the patients does not really worry about it until they run out short of breath.
Right.
Oh, yeah. So this is our problem, our dilemma, how to make them aware, our general populations, that these symptoms are quite frequent, but it is not really cause an alarming red light to them.
So what symptoms should kind of be a red alert that you might possibly have lung cancer?
Well, number one, actually, it's a non-specific again. So if a person or if somebody will experience a cough, lingering cough that doesn't go away with the usual antibiotic medication, and if it is associated with weight loss, loss of appetite, back pains, and sometimes difficulty in breathing, painful breathing, and some, expectorations of, sometimes it's a blood streak, respiratory secretions, and they should be, that should be a warning sign for a possible neoplasm, especially if there is a imaging appearance, chest X-ray, the simplest one, appearance of a lesion, which does not disappear, or it will grows bigger over a period of time. So these are the warning signs that the patients should be aware of.
Okay, so if you are experiencing any of these symptoms, go see a doctor right away.
Yeah, you have to.
Okay, doctor. So we'll talk more about lung cancer when MedTalk returns.
Before lighting that cigarette, think again. Did you know that there are more than 7,000 chemicals in a single stick? In fact, 250 of these are damaging to the body, with 50 chemicals directly linked to cancer.
We are back on MedTalk, still talking about lung cancer. Let's talk about some myths about the disease. But first, we have a caller on the line. Good evening, Naomi Villanueva.
Hello, good evening, ma'am.
Hi, Naomi. Your question, Naomi?
Hi. Hello.
Hi, Naomi.
Hi. Good evening. Good evening, Doc.
Good evening, Naomi.
Apo. Ask ko lang po yung question. Hello?
Go ahead, Naomi. What's your question?
I've spoken for almost 3 years. Then all of a sudden, nag-full stop na ako kasi mag-cigarillo. Pero nung time na yun, nag-cigarillo ako, wala akong nararamdaman na asthma or something, short talking yan. Ngayon kasi nung nag-full stop ako, nahirapan na akong humingi. Tsaka nagkaroon ako ng symptoms na nagkaroon ako ng asthma. Tsaka yung pagtulog ko, kailangan ko mataas yung unan ko pagtulog. May risk po ba ako ng lung cancer po kapag ganun po ba mga symptoms? Hello?
Okay. Okay. Ang mga naramdaman mo, Naomi, is actually non-specific, kagaya ng nabanggit natin kanina. Yung risk mo ng lung cancer, pwedeng umakyat yan pag patuloy natin yung bad habit ng smoking. So, kagaya ng consumption ng a pack of cigarette a day for several years, pag tuloy-tuloy yan, or kahit na mayroon interruption pero mayroon relapse, pwede ka magkaroon ng tataas ang risk natin for the disease. So, ang mga naramdaman mo sa ngayon ay non-specific, hindi naman yan lung cancer sa palagay ko. But depende sa degree ng naramdaman mo, dapat hindi yan kailangan ipagbaliwala. Kailangan matingnan ka kaagad ng isang dalubhasang doktor para masuri kung yan ba ay simpleng airway problem lang yan or ibang problem. So sa ngayon, huwag ka masyadong mag-alala dyan sa smoking. Ang importante ngayon ay i-maintain mo yung quit abstinence period mo. Kagaya ng sinabi mo, nag-quit ka na. So that is good. Congratulations. At yun ang gusto natin mapa-atid sa ating mga kababayan na itong smoking ay talagang mapagdala ng pinsala sa katawan natin.
Thank you, Doc.
Okay,
Welcome.
Naomi. Na-answer yung question mo, Naomi?
Apo. Thank you po. God bless po, Doc. Thank you po.
Okay,
Welcome.
thank you. Okay, so first let's talk about myths, because some people are saying, like for example, some people believe that only smokers can get lung cancer. Is that true?
Actually, that was the previous belief, only smokers. But nowadays, we see frequently non-smokers. And this group of non-smokers are, significant portion of them are being exposed to a smoker, probably in the household or in the workplace. So there was a study on this actually done in Japan. And the wives of the smokers get a high percentage of lung cancer. So this has been a established study in Japan. So the myth is wrong, no?
Mm-hmm.
So even if you don't smoke, we do have cancer potentials in a patient. We mentioned a while ago that the other risk factors aside from smoking are present, and that is genetics. And other risk factors are exposure to some chemicals, and in some portion there was a exposure to asbestos in previous years, way back in the 60s, when asbestos are used for interior
In the home, yes.
Yeah, as an insulating material. And people that are exposed to that, substantial number of people have developed some form of a lung cancer called mesothelioma. And that is the cancer of the internal lining of the chest wall. So, sort of that thing.
These are harmful chemicals that you inhale.
Yes.
That can lead to lung cancer.
Yes.
And other pollutants as well, right, Doc?
Yes, other pollutants are just implicated, but it is not yet confirmed. But these are mixture of pollutants. Sometimes it's difficult to make a study on them, and they could be just implicated if a person, like say, is exposed to chemical in a factory or so for many years, and incidentally, he developed a lump in the lungs, then that could be one implication. But it remains to be, studied and to be confirmed.
And will a mask help?
Yes, actually, in the workplace, we advise our patients to wear masks, especially if the fumes is so much irritating to the nasal passages. And this could not only cause the acute effects of this is the irritations, painful. It's sort of can stimulate the secretions of abnormal liquid.
Okay, Doc.
Yes.
So other people naman are saying that they're too young to get lung cancer. Is that true? May pinipili bang age ang lung cancer?
Well, most of the afflicted individuals are in the elderly age group, 16 up, because with age, neoplasm goes with age, that is the general belief. But in the younger population, lung cancer is not that frequent. But we do have cases, we call it cancer in the young, among individual like age of 23 years old, 21 years old. These are not congenital abnormality. Which means that they were born with lung cancer or a lump in the lung that grows when they get older. No, it is a programmatic, disease. When they reach that age, it just appeared earlier on, rather than the later years in life.
Okay.
So this involves again genetics, and there are spatial histologic features for this kind of cancers in the younger individuals. But at times in our experience, we do have cases, but we can just count on our fingers those cases. But even those are just few. We should not be,
we should be mindful of it.
We should be mindful
still.
of those
cases.
Younger individuals who are exposed to an established risk like smoking.
Right. Okay.
Yeah.
And then some naman are saying that since they don't experience any symptoms, they don't feel anything, so they're probably not sick. They don't have lung cancer. Is that true?
Well, the majority of the cases that we see are symptomatic, but there are again a substantial percentage of patients that are asymptomatic. When you say asymptomatic, they don't really have complaints. So there are what we call an incidental findings when they have their executive checkup or when they have a clearance for a surgery and a chest x-ray is requested, and there is a surprising findings of a lump or a fluid or a enlarged node or a mass or a nodule.
That's when they'll find out.
Well, yes, and that is a point where a suspicion will be considered in this patient. So until it is proven cancer by biopsy, of course, there are a lot of diagnostic procedures that this disease could be confirmed with.
And some also naman are saying that, low tar or light cigarettes, are safer than regular cigarettes. So what's your take on that?
Well, that is the technique of the advertisers. So a low tar and a regular tar cigarettes for us is the same, because it has been shown in the study where people who smokes low tar tends to smoke several cigarettes for compensation. So, so either a low tar or a regular tar, there is no distinction. Your cells will not, will not know whether that smoke comes from a low tar or a regular tar.
So there's no difference. Tobacco is tobacco.
No difference.
And then some are, say pipes and cigars don't cause lung cancer. So.
Well, the study showed that compared to the regular cigarette, the pipes and the cigars are less in producing lung cancers. But again, they are tobacco, and they are still they could still pose a risk for lung cancer.
Okay, so definitely not true. Yeah. And then also for those who are probably in, they're elderly or maybe above 60s, 70s, they'll say that they're too old, for if they are diagnosed with lung cancer, they'll be too old to be treated. Is that true?
Again, that is a myth. Right now, the technology, will will provide treatment even for the elderly patients. So the lung cancer in the elderly actually is a different subgroup of patients. And when we say elderly, these are group of age of 65 and above, and extreme elderly is 80 years old and above. So it is still worth treating a patient even in the age of 75 and 80 years old, because we could still, age is not actually a factor for treatment, because there are 70 years old that who are really still strong. No, age is not included in the criteria. Actually, it's the least, but it's more of the function of the body. It's more of the physiological function. When they are good, when say performance status are good, so heart function, lung function, kidney function, the liver functions are good. They could be, they could accept the adverse effects of whatever treatment that they will receive. And with experience, I can say that a lot of patients, more than 75 years old, underwent surgery for stage 1 cancer, and they survived.
Okay.
And also...
do they regress? Do they end up going back into the habit?
Yes, of course, after a pulmonary rehabilitation and a general rehabilitation. So surprisingly, we see them really recover.
Okay.
So, and those also with receiving the conventional treatment, a combined modality of treatment, as you know, treatment, we work hand in hand with our colleagues in the medical oncology field, in the radio oncology field. So we work hand in hand.
Okay.
So it's a multidisciplinary approach when we go to the treatment.
Okay, and the last myth is some could be diagnosed by cancer and have a mindset and think, well, I have lung cancer anyway, so there's no point in quitting smoking.
Well,
what
that
can
is
you
not
say
true.
about that?
Well, you see, if a patient is receiving treatment and diagnosed with lung cancer and he is indicated to receive treatment, continuing smoking with treatment, you know, will give some resistance to the treatment. So the treatment will not work. There will be resistance to the chemotherapeutic agent if the patient is a candidate for receiving that line of treatment, or even, and the disease will not, there will be some inciting risk. The risk will continue even if he had the disease.
Right.
So another tumor will come up.
That's true. I mean, if smoking wasn't good when you didn't have lung cancer, then the more it won't do any good when you do have the lung cancer.
Yes.
Okay, so we'll talk more about tonight's topic when MedTalk returns.
While there are many reasons why people get lung cancer, smoking by far has been tagged as the main culprit. But how exactly does smoking cause lung cancer? According to the U.S. Department of Health and Human Services, smoking paralyzes and obliterates the cilia, or the tiny hairs that line your upper airways. This exposes your body to possible infections and prevents your lungs from getting the right amount of oxygen. Smoking also annoys your lungs and eventually leads to phlegm, making it hard for you to breathe. The dangerous toxins can also disrupt normal cell growth, forcing cells to multiply too quickly or develop abnormally, resulting in the formation of cancer cells. The good news is that the sooner you stop, the better it is for your lungs and the rest of your body.
And we're back here on MedTalk, still talking about lung cancer. You may join the discussion by calling our hotline at 4678. Now, lung cancer is a preventable disease, like what we were talking about earlier, but what is the importance of being able to detect it early?
Well, the importance is the mortality will be lessened. So that is the impact of early detection. So it has been shown in the, again, a large study, the National Lung Screening Trial study, that 20.3% exactly those early detected by CT scan, these are use of CT scan, can be prevented from dying. So these are just a early study, and we know the fact now that if it is detected early, then we could really tell our general populations that, hey, you have to quit smoking and to have your selves check if you belong to the high risk group again. So that is the big lesson that we really have learned from that development just 2 years ago.
Now, you mentioned earlier that sometimes you don't really show much symptoms of lung cancer. So how do you know if you need to get yourself checked?
Yes, so if a person will have an abnormal incidental findings in the X-ray, specifically a nodule or a mass lesion or abnormal shadow or a fluid, have it checked for to be sure if it's just a old scar, or if it is an infection, or if it's an evolving neoplastic or cancerous process. And there are a lot of things can be done, diagnostic procedures, non-invasively and invasively. So there are a PET CT scan also. This is a high-tech technology, which are already available in the Philippines, by the way. So this could detect, you know, a abnormal signal that could be a tumor rather than an infection. And we have a what we commonly do, a bronchoscopy. So we could check the airways and could do some biopsy and washing and could validate whether these cells or the structure is studded with cancer. Or if a patient will present with a lump in the neck associated with respiratory symptom, then that could be biopsied by a surgeon, our colleague. We call our colleague to do a cervical node incision biopsy or excision biopsy. And our colleague in the pathology section would help us, you know, validate if really it is cancerous or not. So there are a lot of things. Aside from this, the pleural fluid in the lungs could also be checked for cytologic examination. And the last result would be an open lung biopsy. So that would be a technical, very technical, but it is frequently done in those cases that are really indicated. And at times, we could have cancer diagnosis with the biopsy specimen at hand.
And when diagnosed with cancer, there's, of course, different stages.
Yes, so the next step, the first step actually is the tissue diagnosis. So once we have the tissue established to be cancerous, then the second step would be the staging. So the staging is very important to know whether the patient belongs to a stage 1, 2, 3, or 4. Stage 1 and 2 are, stage 1 is very curable. In fact, the survival rate for stage 1 disease is about 70%. And stage 2, a little bit lower. Stage 3, in the middle. Stage 4 is really not that good. So these are the second step that really our thing. No? So we do the diagnosis, we do the staging. So there are a lot of complementary examinations. Then this include imaging procedures, bone scan, and upper abdominal scan. So we have a protocol for that.
What age would you recommend for people, especially smokers, to go and get their, like maybe a physical exam with the CT scan and the chest X-rays and all those tests that are needed, just to see if you're, if you're healthy in there?
Well, if we are going to follow the inclusion criteria of the group of patients that was included in the study, the lung cancer, national lung screening trial, their age of onset is 55 years old, up to 74. So those age group was included. But nevertheless, if a patient has been a smoker for long, he started smoking earlier on, like 15 years old, 17 years old, he smokes. So you can, include him in the early detection. Although we don't have locally, we are still on the planning for a local study for that. But the established study has been shown already to have a impact on the yearly screening.
So yearly screening might help, especially if you're age 50 and above.
Yes, and this is the use specifically of the low-dose CT scan procedure, which has a higher yield for compared to an ordinary chest X-ray.
Okay.
So low radiation dose at the yearly level for 3 years to 5 years, but up to that point in time, the patient could decide whether he will continue on the screening process.
Okay. Now we have a question from Facebook, and this person says that his doctor says that he will have an operation for his lung cancer. So why does he want this patient to have chemo and radiation before undergoing surgery?
Okay, that could be possibly a strategy to downstage the tumor. Probably the lung cancer is in stage 3A disease, and studies showed that these are part of the neoadjuvant treatment. We call it neoadjuvant treatment before surgery. So before surgery, the patient will receive both either chemo and radio to lessen the tumor burden, to lessen the tumor, to shrink the tumor a bit. And the surgery will remove a smaller bulk of the tumor much easier.
Okay. So we have another question from Facebook, and the question is, my mother has led a healthy lifestyle, but was diagnosed with lung cancer. Is it because she was living with a chain smoker, like her father?
So that is the case for have been exposed to household smokers, and surprisingly, without any warning at all, a person could be symptomatic. And the lesson that we could get from that story is that we have to ask household family members, especially family members that who smokes, to stop smoking if it is possible, really to quit no matter what. They have to try.
I thought you were going to say smoke outside or have a smoking area,
well,
but no, just
second.
stop smoking.
Stop smoking first. Stop. And if they could not control themselves, they have to seek advice, medical advice. But if they try to smoke really uncontrollable, they have to distance themselves from other people.
Okay, so we will talk about maybe how to help these smokers stop smoking. But before we do that, we'll talk more about tonight's topic when MedTalk returns.
Did you know that your health will improve 20 minutes after you quit smoking? According to the American Lung Association, your heart rate and blood pressure will decrease, and the oxygen content of your body will shoot up.
Welcome back. We're back on MedTalk, still talking about lung cancer. So now let's talk about treatment options, Doc. What are the treatment options that are available these days for lung cancer patients?
Well, as I've been mentioning, the stage 1 disease, those that is still confined to the lung and is a small nodule, less than 3 centimeter in diameter, and no other involvement of the other lung and the other part of the body. So the definitive form of management here is surgery. And usually it is curable. And we have seen that a lot survive over the years. Over the 5 years period, 70% of them are alive. So the other forms of treatment will be a form of a combination. It depends on the stage, whether they are stage 2, which means that the tumor is a little bit bigger, and there's involvement of the pleura or the covering of the lungs, and there are this treatment would entail surgery also, and may be followed by some form of systemic cytotoxic chemotherapy. In general.
So there's different kinds of chemotherapy?
Well, our colleague in the medical oncology knows best, and there are different kinds of chemotherapeutic agent, from the basic cisplatin and cisplatin combination with other drugs. So there are different options for a patient to be to undergo chemotherapy. And
what
these
about
can be
radiation?
given. Yeah, radiation also is a form of treatment that could be given if there is painful, if the tumor compresses a structure, and that could cause some form of a obstructions of a vessel, like we have a superior vena cava obstruction, that is a tumor in the right lung, in the near the middle of the lung, and it usually frequently compress the large vessel. So that radiation treatment can be an option there. Or patients that have a painful lesions, metastatic lesions. These are stage 4 patients. Patients could receive palliative form of radiation. So for pain, addressing the pain, apart from the pain medications, of course.
Okay, so you have surgery and chemotherapy and radiation. It depends on what stage you're in.
Yes,
so
or combination.
Or a combination of all three. Now, what about the survival rate of lung cancer patients?
Well, the survival rate depends on the stage, actually. So stage 1 is higher, the highest survival rate group. The stage 4 is really the lowest survival rate. So say in 5 years' time, only less than 10% or only 2%, 1% of patients are alive if you are stage 4. But that is not without, that patient does not receive treatment. But if the patient will receive treatment in one form or the other, the survival stage of the patient will probably improve a bit. Especially at this point in time, the treatment now is so personalized. We have a personalized treatment for lung cancer. And technology actually really came up, but still at the tip of the iceberg. We have now a molecular targeted therapy that use tablet, and these are being guided by a test. If your cell has a evidence of mutation pertaining to EGFR, the epidermal growth factor mutation, we have now available here. So these patients will be a candidate now for a specific targeted treatment for that alone. So it has been shown to have a very successful response.
Okay.
Yes.
So what about coping and support by family members or professionals? How important is this, and is it available for patients?
Yeah, any patients that is inflicted with cancer, needs really a special support from the members of the family, because emotionally it's too draining. Once you have cancer, it's really draining, and of course, majority of our patients accepts the nature of the disease, and they could cope up actually in the long run. And family members have a great role in supporting the not only emotional, financial aspect, but of course in continuing the living on. Have to move on.
Right.
Have to move on.
Right.
Because it's not
easy,
the end
for
everyone who have cancer in general, and with lung cancer in particular. It's not the end.
And
So,
going through treatment alone, it's very draining and tiring also for the person who's undergoing that treatment. Are there support groups for patients to go to?
Well, in other countries, there are support groups. We have a support group for, I think, for the breast cancer. A lot of support groups out there. For lung cancer, we do have a counseling group. Okay. But a support group, I think it's still on the way.
Oh, okay. So it's still underway. So
Yes.
we should probably start. I mean,
Yes,
some group should probably
yes.
start one. Now, Doc, prevention tips for those people who are listening right now, especially the younger people, so they know the risks and the dangers that what that can lead to lung cancer.
Well, number one is you have to have a clean lifestyle. You have to have a regular exercise again. Watch your diet and avoid vices like smoking. And if you have friends that will smoke, do not be enticed to smoke as well. And if you are smoking now, you have to try to realize that when you continue this, it will just be detrimental to yourself, and not only to yourself but to your family. So you have to seek advice for smoking cessation. We have quite a number of smoking cessation clinics out there in the hospitals, base hospitals. We could consult and they could help you.
Okay, so now we have a question, Doc, from Twitter. And this person said that, I read something about third-hand smoke. What is this one about?
So we have a first-hand smoke, then a second-hand smoke.
What is a third-hand smoke?
So a third-hand smoke actually is a smoke that really, the smoker is not there anymore.
Okay.
You can't see the smoker, and even you don't see anybody there anymore.
It's just the smoke that's lingering around?
It's not even lingering.
Okay.
The smoke has, been absorbed by like carpets.
Oh, okay.
Or any, linens. So it emits fumes and materials that could be still detrimental.
Right.
So this has been shown in the study, like babies creeping in the carpet, and process of the smoke touches the carpet, and they could still emit radioactive materials. And these are a point of study up to now, third-hand smoke. So it has been shown that this could be implicated as a risk factor also.
Right, right. That's why there's such a term called as a smoke-free environment.
Yes. Yes.
Because that really could help, especially for children, babies who have small lungs.
Yes.
So now, Doc, final words, anything that you'd like to add for everyone who's watching out there?
Well, we know that the awareness for lung cancer comes with when we see something that is afflicted with lung cancer, and that's the time that we would be aware. But we have to change our paradigm, as in general. We have to be mindful of what out there could be a risk factor for lung cancer. And by the way, I want to remind everybody that May 31 is a no tobacco
day.
So,
that means nobody smokes.
Nobody smokes. So we hope that
Peace for a day.
many will quit smoking. And this will just remind the general population that smoking is really dangerous to everyone's health.
Right. And if you are hooked into smoking, there is help out there, correct?
There is help out there.
Right. Well, thank you so much, Doc, for coming to MedTalk and talking to us about lung cancer. And I'm sure a lot of people learned a lot tonight.
Thank you very much.
Thank you. That was Dr. Winfield Tan. Thanks again for enlightening us about our topic for tonight. And we'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation here on the Solar News Channel. This is Claire Saldran. Good night. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Claire Saldran, sitting in for Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
If you think about it, lung cancer is easy to solve.
And joining us tonight is Dr. Winfield Tan. He's an active member of the Council on Lung Malignancy of the Philippine College of Chest Physicians and a fellow and diplomat of the Philippine College of Physicians and the Philippine College of Chest Physicians. And you may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Win. How are you tonight?
I'm fine. Good evening, Claire.
Good
Thank
evening.
you for inviting us here.
So tonight our discussion will be about lung cancer. And like what we heard earlier, that there is a high incidence of lung cancer in the Philippines. It's a deadly disease that people know about, and yet, it's still there. So what are, or who are the people who are prone to getting lung cancer?
Well, number one, that are the smokers. Those that smoke more than a pack a day for more than 10 years or so, they are at the very greatest risk for the lung cancer disease. And those that are with family history of cancers are likewise at risk. And the other group of patients are actually non-smokers. We are maybe surprised to hear about that, but evidence had been shown that in some group of non-smokers, especially women, but they are been exposed to other people around them, are at greater risk.
Yes. You mentioned that it's also hereditary. So let's say you're not a smoker and you have some history in your family who's had it. What percentage or what are the chances that you might get lung cancer?
Well, overall, as hereditary plays a very important role.
Symptoms usually do not appear until it is too late.
Patients will become breathless, they cough, they also spit out phlegm. Many of them will also start losing weight.
But while lung cancer is preventable, it is also one of the least curable of all types of cancer.
They can decrease the risk of themselves having cancer in the future by avoiding high-risk behavior like cigarette smoking, alcohol consumption, exposure to chemical irritants in the environment, eating a healthy diet. These are not curative measures, but they can prevent. If a patient is diligent enough, it can actually prevent cancer from occurring.
How is lung cancer detected and treated? How can smoking lead to lung cancer and other complications? Find out the answers tonight on MedTalk. Sidestep, primarily because we know what causes it.
For the most part, we hardly see Filipinos consulting very early in the disease. And that's very sad because the earlier you intervene, the better it is for patients because the earlier it will be for us to help them.
Today, lung cancer remains to be one of the top killers in the country. Even non-smokers are at risk. According to the World Health Organization, 50% of Filipino women and children are exposed to secondhand smoke because of their proximity to smokers.
Obviously, Filipinos have not learned, and it's not just here in the Philippines. It's actually something that's also observed in other countries, that despite very aggressive anti-smoking campaigns, there will still be that one person who will still smoke.
Most people often ignore the danger signs simply because